Welcome to the High Tea with Grace podcast, where we spill the tea on HIT. Today, I'm honored to be here at the Civitas Conference, a fantastic event filled with healthcare technology leaders in the health information exchange space. Today, I'm honored to welcome Jan Lee, CEO of the Delaware Health Information Network, also called DHIN. Thanks for joining us today, Jan.
I'm happy to be here. Thank you for having me.
So tell me a little bit about the career path that brought you to your role today.
Oh my. Well, I am a family physician. I spent 23 years on active duty in the Air Force, and I never wanted anything more than to just be a really good doctor. But if you take enough breaths and you don't do anything bad, you get put in charge of something. And I learned that I actually liked leadership positions. It was a tough transition from the office to a management role. But when I became convinced that I could actually do more good for more people by creating a healthy environment for good people to work in, that kind of gave me the motivation to stick with something that was not my original career dream. Well, time goes by. I was nearing the end of my Air Force tenure, but not quite ready to retire. The bell rang, it was time to move, and all three of my kids were in high school, and I just thought that was a terrible time to move them. And so I was stationed at Dover Air Force Base at the time. I called the colonel's group and asked them to find me a real colonel's job somewhere in the national capital area, and my intention was to commute. And that they said, "You're crazy." And I said, "Granted, but work with me, okay?" And so I got a call back a few days later, and they said, "Well, this is a special duty assignment, and you may or may not be interested in it, but we have a position that's needed for somebody to lead the implementation of the DoD electronic health record across the Air Force medical facilities." Now, being a special duty assignment, I would have to interview for the job, which is not the way things normally work in the military. But the person that I would be working for was the CIO of the Air Force Medical Service. So I went and I did the interview, and I said, I would not want to present myself under false pretenses. I'm not really a technology person. I'm a physician. And I'm not afraid of technology, but I'm not in love with it. To me, it's a tool to get something done that I need done. And so if I'm convinced that it's going to help me do something I care about better or faster or to a higher quality, then I'll make the effort and I'll learn. And he said, "You're who I want." And so it was really a boundary spanner role. Because I had been a commander, I could talk to the leadership structure at each of the facilities and say, here are some things you need to think about in order to be ready for something that will be a disruption. You've still got to maintain access to care. You've still got some imperatives, but if you don't give your people time to learn this correctly, you will have problems that extend in perpetuity. So here are some things to think about. And then I could walk down the hall and meet with the professional staff and talk to them as a fellow physician and say, here are some things you're going to like, and here are some things you're not going to like, but ready or not, here it comes. And so I was so fortunate that I had a boss who supported me and didn't expect me to be a technology expert, and to have a team working for me that was not offended that I was not a technology expert.
And it was appreciated your background.
Yes. And they said, what we need the top cover from you. You're the colonel. You need to clear the way for us. And so they were just so supportive from above and below in my chain. And I could not have asked for just a more wonderful work environment. And you know what? I drank the Kool-Aid.
Wow.
It was like I came away from that going, health IT really does have the potential for addressing so many things that frustrated me as a practicing physician. Boy, do I have stories. But so that's kind of the backwards way that this little family doctor got into health IT. When my boss was ready to retire, he recommended to the Air Force Surgeon General that I replace him as the Air Force Medical CIO. And that's it. No physician had ever had that role. And I'm going, you're crazy. I know who you have been grooming for this position, and it isn't me. And he said, we'll take care of him and we'll make sure he gets a good assignment. and something that's good for his career, but he said, you understand the operational environment that all of this stuff has to work in. And that's who we can surround you with the technology experts, but we need your leadership. And so my last assignment in the Air Force was CIO of the Air Force Medical Service.
Go, girl!
How did this happen? Life takes some strange turns. So I even tell my kids, when they were going through college and everything, you got to have a plan. You got to get out and be able to get a job and support yourself, but you don't have to know at 20 what you're going to do for the rest of your life. What I'm doing now did not exist when I was in college. There's no way I could have planned this career, but you stay open to the opportunities that life presents you and be ready to do something that isn't what you expected.
Absolutely. So this is incredible. I love to hear about your journey. And we're here at Civitas, where healthcare leaders from across the country are sharing ideas about health information exchange. What key trends or innovations are standing out to you now as the leader of DHIN at this year's conference and just in your work that you're doing there in Delaware?
Well, for sure, we are at the stage now where it's well beyond simple interoperability and connecting this provider to that one and getting them all connected to the hospitals. We're past that. And we're now having the national conversation about how do we stitch all of this together into a meaningful, usable national network. Great strides have been made. We are not at the end of that journey yet. And so there's TEFCA, there's the CMS interoperability framework, there's all the things there's the private networks that are still springing up for use cases that are not currently supported by some of those broader networks. I think the consumerization of health data is getting bigger and bigger all the time, and we got to be paying attention to that. Consent to share, as the prospect of genuinely sharing data much more broadly, is both an exciting opportunity, and for some people, it's a very real threat. It's scary. And so making sure that we have the proper tools in place to capture and honor patient preferences about how their data is shared and with whom is really critical. And it is not as easy as it sounds to get there, but that's a big deal these days. And oh my goodness, there are so many trends, but those are the ones that kind of jump out at me right now.
Absolutely. And I've heard that one of DHIN's core goals is improving patient outcomes through reducing duplication of services and deduplicating. Yes. Can you share a concrete example of how your network has prevented unnecessary tests or streamlined kind of care coordination for patients?
Yeah, a few years back, actually probably nearly 10 years ago now, we brought in a third-party company to do a rigorous assessment of had we in fact produced value for our state. And at that point in time, a lot more that could be said now, but at that point in time, one of the big value propositions was the reduction of duplicate testing. And they were able to go back and look at, from the time that DHIN first got started, as the network grew and more people were participating, the volume of high-cost labs and radiology studies per capita was going down.
Wow.
And it was pretty dramatic. And so we would share this data with others, and it's like, well, you weren't the only ones working on this. It's like, yeah, I know.
Will you just let me have a win? This is a big win, okay?
You can't claim all the credit for that. It's like, well, I think we get a good hunk of it personally.
Yeah. And why do you feel, what were the reasons behind how you impacted that data?
We tried to start where our market was. Now, we got our start before the Recovery Act and high tech and all of that. And so we were not starting off from a position of responding to what the folks in Washington thought we should be doing. We were starting from a position of what does our own market want. In 2007, when we first went live, most physicians did not yet have EHRs.
Wow.
And so we were really looking at how do we serve everybody, no matter where they are on the technology adoption curve, we've got to serve everybody. And so we were very cognizant of there are people that are still on paper and we've got to offer them something. There are people that have EHRs, we've got to offer them something. And so by design, we attempted to craft all of our services in a way that anybody could get on. And of course, then when the EHR incentive program came along and now the ratios are completely opposite, you could literally count on my fingers and toes the number of practices in Delaware that are still on paper. And so as more have gotten on the technology bandwagon, the needs of the market have shifted, and we've tried to stay very in tune with our own market. So our flagship services were electronic results delivery at a point in time when that was not the norm, and then the longitudinal community health record, we call it, that allows people to see the breadth of data from all the different sources. Close to 100% of Delaware providers use our community health record. If there are any that don't, it's probably because they barely moved to Delaware.
Wow.
I mean, we are ubiquitous.
That is tremendous success.
It is.
Tremendous.
All of our hospitals, all of the labs and imaging centers, our skilled nursing facilities, all are a part of this ecosystem. And I think if anyone talked about shutting DHIN down, the whole medical community would rise up.
Absolutely. It sounds like it because it's critical to the work that they're doing. Let's talk about healthcare costs. It remains a pressing issue nationwide. How is DHIN kind of demonstrating that better data sharing can directly contribute to lowering costs for providers, payers, and ultimately patients and caregivers? Well,
so one of the things we are actually doing is working with our partners at the state on some dashboarding. And we are also the all-payer claims database for Delaware. That's a relatively newer service for us. But because we get both clinical and claims data, we are in a position to look at both cost of care and clinical outcomes. We've demonstrated our ability to match a claim not only at the patient level, but at the encounter level. Get a claim for a particular service done on a particular day, we've got the clinical data that corresponds to that service. And so we are in a really amazing position to be able to say not only what happened and what did it cost, but what were the clinical outcomes. So sometimes you got to spend money to save money. Sometimes it makes sense to pay more if you know you're going to get a better outcome. And it's been really hard to study that. So we're very excited at the partnership we have with the state to inform public policy with real data.
Wow. This is amazing. And I'm obsessed with the information that you're sharing with me because this is a world that I don't think patients and caregivers typically consider. We don't even know what's happening in the background. We just know that, healthcare actually is costing a little bit better. We don't even realize it until it finally hits us, right? But as the first statewide HIE, you really set a precedent with DHIN. And I'm wondering, what role do you see HIEs playing nationally in the next 5 to 10 years? It's going to be different, similar to how it's been different the past 5 to 10 years and how it played a role in Delaware.
I don't think we're going away. People have been predicting our demise for years now, and we're still here. I think the pandemic really illustrated the criticality of having geographically relevant data aggregation. So we are doing things in our market, in our geography, that is not replicated by the EHR vendors that are making big nationwide networks of their users and the other big national networks. When you've got a pandemic and you're trying to figure out what's going on in my region, in my state, you need aggregated data about that geographical region, and the HIEs have that. And so I don't see us going away, but I also realize when DHIN got started, we were de facto a monopoly, and we're not anymore. And we're very aware that there are others doing pieces of what we do. There's nobody that would meaningfully compete with us who does all of what we do. But depending on the customer segment, they may say, I don't need all of what you do. I need this. And I like the way they do it better. So we're very conscious of the fact that we can't take anything for granted. We can't rest on our laurels. We have got to always be responsive to what our market is asking for.
Well, they have a fantastic leader at the helm. So they're very lucky to have you. So my listeners love to learn about what's happening in the industry, and they also love to hear from women leaders about what drives them and what keeps them going on. If you could give your younger self a piece of advice, what would you tell her?
Whew.
And it can be multiple pieces of advice.
Yeah, there's a lot of advice I would give myself about how to behave. It's just like things I have learned in some cases the hard way. But I think it's what I've told my own children, as I shared before. It's good to have plans. It's good to know what you want to do and be ambitious and have goals, but don't be too rigid about it. Don't be so rigid that you don't recognize an incredible opportunity when it comes your way, and be willing to be flexible and take life as it comes. So, yeah, I think that would be it.
Fantastic. To finish this conversation off right, where can our listeners find you online?
Well, we are at DHIN.org, DHIN.org. We have a Facebook page as an organization, and we're on all the social media stuff. We're on LinkedIn. So.
That's terrific. Well, thank you for joining me today. It was great to learn from you.
It's a great pleasure. Thank you.
And thanks to you folks for joining us too. Check out the High Tea with Grace podcast for more interviews with great guests like Jan today. Cheers.
Like a Girl Media is more than a media network. It's a community. We want to meet you and amplify your voice and the voices of outstanding women innovating in healthcare. Interested in starting your own podcast or hosting an event near you? Connect with us online or in person. We're here to support and empower you.